next 20 years we can expect at least 15,000 new houses in Sussex. And yet, to even contemplate reducing what we've got now is, bearing in mind we've got all this facing us, how can it be contemplated at all? It's indescribable.
You've got a vastly growing population, and so the demand is going to grow and grow and grow, and particularly the demand for maternity services, and you would think for A&E. And we have a major motorway on our doorstep. We have Gatwick Airport 12 miles down the road. You know, this is a place that needs to have a full hospital with all the hospital services. So the issues that affect us are those that are affecting hospitals in growing areas all over the country.
Patients were meant to be at the heart of the NHS, and accessibility has always been raised as an issue, that patients should be able to be treated closer to home.
It's quite important that the health service should be responsive to local people, and you cannot get that while it remains under national control.
There are people here who really know what they're talking about. There are families whose children have been born there, whose elderly parents whose lives have been saved in the A&E. But this hospital is really part of its community. They do know what they do need as a local hospital, and people need to listen to what they say.
People who are managing the service across Sussex at the moment and have created an appalling quality of service, poor patient service and a financial deficit are not the people to then dig us out of the hole.
Yeah,
and
exactly.
There is a fundamental thing. When a company is in trouble, you get rid of the senior management team, you bring in new managers, you give them clear objectives, and you set them on the job, and that doesn't appear to be happening.
You know, you can be aware of the fact that the NHS is obviously struggling in money and resources, etc., and you can see exactly why they're wanting to close down the hospital.
I literally live 5 minutes away from the hospital, so it would be really pointless to go all the way to Brighton.
If you have to make that journey, you know, that's a long journey.
Yeah, I don't really like the thought of having to go to a further hospital.
Like, there's so much traffic going into Brighton that it's going to be even harder. It's like the accessibility is going to be even harder.
Distance, if I'm home alone, I don't drive, I'm not old enough yet. I'd have no idea how to get there.
It is the difference between life and death, sure.
What happens now?
Well, I'd already written to Gordon Brown on the basis of the speech that he gave when he accepted the party leadership, when he said he was going to listen to people, ordinary people, he was going to take notice of what they said, and he was going to put the National Health Service first. So I wrote to him inviting him to do just that, to listen to what we're saying, to respond to what we're saying, and to understand that what we want here is our local services at the PRH.
I'm going to talk about this for the first time on your programme, because we haven't discussed it in public yet. But I am looking at a new plan which was put to me by a constituent who wrote to me this week and said to me, why not look at a scheme whereby the Queen Victoria Hospital in East Grinstead merges with the Princess Royal, thus giving the northern part of Mid-Sussex a sort of foundation hospital base and giving the East Grinstead Hospital greater critical mass, and taking the Princess Royal out of the calculations insofar as the Royal Sussex County Hospital is concerned.
We have three options, each one of which involves the Princess Royal being downgraded, and one of them involves it being downgraded to no more than a community hospital. One
of the arguments of keeping the Princess Royal A&E is that if you had a major accident, you could stabilise people here and then move them down to Brighton. But one thing that I want to make absolutely plain, whatever changes are proposed, we are not going to allow them to take place until they are properly, certifiably funded, properly, certifiably organised, and the infrastructure to deliver those services is there. After the last changes, I mean, they hadn't even thought about transport to Brighton. You know, that's appalling. You know, so we've got to make sure that all that sort of thing is in place. But we're all working to a common end, which is to get the right hospital services for this area, and that's what we want, and that's what you know, your family wants, my family wants, what we all want. We want to see proper health service. So we've absolutely been scrupulous in avoiding party politics. These changes are taking place across the country, and communities rather than parties have come together. I want people to have confidence that their voices will be heard, but we're going to make sure that they're organised, coordinated, and that we're not just saying no for the sake of saying no. We're saying no because we know what the services that we need here. We're not against change. We know there are going to be some changes. Some changes are acceptable, but not the A&E and maternity services.